Hi, I'm Yeow May, and today I will continue to talk about grief in this COVID-19 pandemic. When we talk about grief, when we think about grief, it is usually within the context of bereavement, when we lose someone close to us or when we lose people who are close to us. But the grief that I'm referring to today is not one that relates to something that has already happened. Because this COVID-19 pandemic is still happening. The loss we are experiencing is a living loss, one that's still ongoing without any clear-cut end date. This pandemic has been evolving and the rules have been changing as well. The recent extension of the circuit breaker is a good example of how this pandemic is forcing us to continually adjust and to adapt. It is highly important that we adapt to this change, but we also need to keep in mind that change entails loss. The losses that we experience may not be clear, they are quite ambiguous. Attachment doesn't just refer to attachment to other persons like our family, our friends, our partner, etc. We can also develop strong attachments to our possessions, certain objects, certain items that we keep, certain places, even strong attachments to our previous routines. This pandemic again has also forced us to face the loss of these attachments. We already know that the experience of grief is complex and it's difficult to process. Some people often say that they don't know how to grieve. And this may be because we don't have the words or the language to articulately describe our suffering. And in this sense, grieving can be difficult. But grieving also tends to be an unpleasant experience. What might be useful is to recognize that grieving is actually natural and that it is okay for us to develop certain responses and reactions emotionally over what we are losing during this period of time. Maybe if we begin by identifying and putting names to our experienced losses, we can start to become more consciously aware of what these losses are and what they mean to us. And this will assist us to be more able to cope with them. For example, it is devastating to lose a job or to receive a pay cut. But it's not just the job itself that you are losing or the money you're receiving that you are losing. It is also about what or how these affect our sense of self and how we view ourselves. So you might be the breadwinner of the family, and not being able to provide like you used to in the past could negatively impact on the way you see your capacity in fulfilling family roles. And studies have shown that our self-esteem and our self-identity can be strongly tied to our job. Conversely, you might realize that because of this whole crisis situation, you're putting in more hours at your work. Say if you are a healthcare worker, frontline healthcare workers, crisis responders. While you're putting in more hours at work, it also means that you are losing more personal time for yourselves, for your family. And again, it's about kind of reflecting and thinking about how this may impact on your role in other aspects of your life and what that means to you. The experience of grief is transient. It's not permanent, even when we are right in the middle of it. And people who cope well, they tend to move in and out of those states. And it's completely fine to allow yourself to be distracted at times, to be entertained, to laugh and to be amused, but not at the expense of recognizing and acknowledging your feelings about what you've lost. Most of us have never been through anything like this in our lives, but we have been through other challenges, other transitions that haven't been easy, whether it's a divorce, a breakup, having to change jobs, relocating to another country. These transitions haven't been easy. And if we think about those things that we've been through, those changes that we had to make, think about how you manage those changes. Reflect on what have helped you to heal in those times and tap on those things. Lastly, it is to keep in mind the transitory nature of this period because the crisis will end one day.